Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
This Thanksgiving morning, before the turkey and pumpkin pie, join us for a tradition that gives back. Grace Med's Say Grace 5K race. Walk, jog, or run with friends and family through Midtown Wichita, all while supporting Grace Med Health Clinic, bringing affordable care to those who need it most. Start your holiday with gratitude, community, and a little exercise so you can enjoy that second slice of pie guilt-free. Register today for the Say Grace 5K presented by Strive Bank. Visit saygracerace.com.
Welcome, guys, to another episode of MedTalks. I am Juvenava, Director of Community Outreach and Communications for Grace Med Health Clinic, and I'm here with Jennifer Hartley from Project Access. Hi, Jennifer.
Hello, how are you?
Good, how are you?
I'm good. Excited to be here, a little nervous, but...
That's okay. Nothing to be nervous about. I appreciate you taking the time to come talk to us about Project Access. What is Project Access?
So Project Access is a nonprofit organization, 501(c). We have over 600 doctors donate their care to help, serious needs, serious medical needs. We partner with the community clinics. So once they see a client that has an issue that is very serious, then they get a hold of us. Their income requirements are 250% federal income level. Doesn't matter, if some of them have a part-time job, they just can't afford, So it's fortunate we can, people with cancer, diabetes. In 2024, we served 750 patients, clients. And $8 million of that was all in donations.
Wow, that's
of treatment.
Incredible.
So yeah, the team that does all the medical side of part of that is very, very knowledgeable and very fun to work with. So
yeah. What I have found out is that a lot of communities have programs like these. Us being based right now in Wichita and South Central Kansas, this is only for Wichita residents. Is that correct?
Yes, it has to be Sedgwick County residents.
Okay, yeah. Sedgwick County residents.
Yes. So, and hopefully in the future, if they could get some doctors to volunteer outside the county, that would be great. So.
We have obviously used this resource a lot with our patients. Talk to us about the importance of having those relationships with the community health centers in Wichita.
Medical is so hard for, people nowadays to get. I mean, insurance is just ungodly amount. A lot of people, we have a lot of unemployed people. Right. A lot of mental health people, which we do provide now with mental health doctors. And so it's just great to have it there because I went through cancer with my dad. Yeah. And, thank God, but now working with people, I see them on the streets and, you just see it, that they need this kind of help. And, so partnering with, people like Grace Med and stuff helps, the community better themselves and stuff. So.
Exactly. And especially most of our patients are patients without insurance. And being in a state that did not expand Medicaid, a lot of those individuals who don't qualify for Medicaid services or can afford to have private insurance fit in that gap. And so Project Access has come in to help assist those. Yeah. Correct?
Yes, we have. And Project Access is now, this is what I do for Project Access this time, is we have partnered with Stand Together, and it's a telehealth, it's called Amy, and it's a telehealth service. So there's no income requirements. Right now, we're doing a free trial basis just to get people interested in it. But then after that, it's $5 a month.
Oh, that's interesting.
It's not insurance, but they could go online, see a doctor. And there would be an additional charge, not $5, but it's only like $9 to see a physician, $29 for a big visit. So we're really trying to promote that because we have so many people out here without insurance that, that we're hoping that could kind of fill in the gap. Yeah. And I'm working with 4 community centers in each part of the town to do a walk-in clinic to try to get the people seen that can't get in to see a doctor.
Okay.
So that's kind of a new thing for Project Access that I'm working
Yeah.
on. So
That's awesome. Specifically, I think sometimes people don't understand the providers who donate these hours and these services. What kind of services they do provide? Can you be a little bit more specific on what
now
you've
we
seen?
do see people with cancer, diabetes. I know we've done several colonoscopies. We do have dental available too. Then, like I said, the mental health. But yes, it's more serious things. And then it's not just the surgery and we're done with you. We do the aftercare, make sure that you're okay and getting back on your feet before we
good.
just let you go. So,
Now, with Project Access, do they have like a caseworker or a health navigator or patient navigator that assists with the entire process?
yeah, so what happens was, say Grace Med calls in and gives us client name. We have a young lady that gets all that organized and, starts getting it set up. Then we have the nurses go out. We do have a bilingual nurse too, so that helps.
Yeah.
Then we have administrative assistants that takes care of all the phone calls that come in.
Yeah.
And then the 2 wonderful supervisors that deal with all the rest of, the funding and the logistics of all. So
Yeah.
they're a really good team and they're really, really, really smart people. And they've been doing this. Project Access has been around for 26 years.
Oh, that's awesome.
So we just did our
That's
25th
incredible.
anniversary and
Yeah.
it's been going really well. Getting ready to have our fundraiser in September to try to keep us going. So
Oh, good. And we're very appreciative of those providers who donate their services and their hours to assist those individuals who are in need.
Oh, absolutely, because it's just it's hard to find, and
Right.
we also are. I forgot to tell you, but we're also in with all the hospitals too. So
Okay.
so that really helps too, because we all know how that goes with the
Yeah.
hospital bills. So
Yeah.
and a lot of people don't want to go to the emergency room.
Right.
If you've been in the emergency room lately, you're there for about 9
Oh
hours.
my gosh, I know.
So it's difficult.
Yeah,
So.
no, very difficult. Are there services that you're looking forward to that perhaps we need to help like recruit like providers that could provide the services that we see that there's a need for? But, and I think anyone who's willing to donate their time and services would be beneficial, right?
Yeah, I know that, we do get a lot of Hispanic clients and stuff, so our, bilingual
Would be
nurses
awesome.
would be good to have, somebody help, her, because she's so busy, but,
Yes.
I'm sure there's a service out there that
Oh yeah.
we're, lacking or something,
No, definitely. And I
so.
completely get that. I get that tremendously. Our patients are always so grateful for Project Access for the service that they receive. What's the goal within the next 5 years for Project Access?
Well, of course we want to keep going.
Yes.
Keep helping people and see more people. I've been doing a lot of outreach events, so we're really starting to get out there, and I think hopefully we're getting more people to come in. And just help the people that need this, instead of suffering, through their pain and stuff. So
Yeah.
I think that's the main goal, is just to keep us all going and keep helping everybody. So.
Right. If people are interested to help support Project Access, how can they do that?
They can reach out to Project Access. You take donations, of course,
Good.
private donations, a lot of that. And then we also have our upcoming event in September. You can go to the Facebook page, Project Access Facebook page.
Okay,
So
that's
that would be
awesome.
good.
Well, very good. Jennifer, you mentioned that you have dealt with this on a personal level too. Obviously, when you work a nonprofit, you do it
Yeah.
because it's something that you're passionate about. Can you talk to me a little bit more about what motivates you to continue the work that you're doing?
Well, so I've had a lot of personal things, and that's what's good to be a community health worker, because your past really helps you, understand people and stuff. And I'm fortunate now to be working with Urban League. I'm doing the harm reduction navigation. My son was a survivor of fentanyl.
Yeah.
And so now I educate the community, hopefully everybody in Sedgwick County, about how to administer naloxone and Narcan to hopefully save their lives. The nice thing about, say with Project Access, if there was a mental health patient that we needed to help, maybe that would help towards the addiction part.
Right.
So I'm very fortunate to work for both companies, because they can kind of somewhat intertwines with each other.
Yeah.
And with that addiction, with people with addiction like that, they don't have insurance. They definitely have medical or mental issues and stuff. and until they get back clean or get help, which is very hard to find for people that don't have insurance.
Yeah.
And so that just puts them out on the street, and then there's nowhere for them to go. So it's just baby steps, one at a time. So Project Access, Grace Med, Project Access,
Right.
so on and so on. And the nice thing about doing all these outreach events, I just love it, because you learn so much
Good.
about your community,
Yes.
and you meet the greatest people. I don't care what side of town I'm on, there, the greatest people. But we're all like a big family. The vendors are a big family, so we share all of our resources with each other by email, phone calls, and so some of us work with the same clients.
Right.
And it's just all coming together, and that's
Yeah.
what it's about.
Well, that's good. I know I've enjoyed seeing you, and my team as well has enjoyed seeing you out in the community doing those outreach events, and so it's very much appreciated. Well, I think one of the things I forgot to ask is if a patient is interested in getting services through Project Access, it's a referral-based
Right.
service, right?
Yes,
So they would need to come to a community health center just like Grace Med,
Yes.
See a provider, establish care and things like that, and then get the referral to Project Access. Once that referral is done, can you talk to me a little bit more about the steps that end up happening? So let's just say patient gets the referral, our referral department sends it to you. What happens next?
So when they get referred to us, then they will go through one of our the care coordinator, and she gets all the basic information, see if they meet the requirements, and then we just take the steps of finding which doctor would suit them, with what they need, match them up with one of the nurses, and then it just would continue. And then they would start setting up the appointments and the treatment and the care, and then they would have pretty much a one-on-one with one of the staff. So
Good. Awesome. Well, Jennifer, is there anything else that you would like to add before we end our... Yeah?
it's been a really fun, busy year this year. It's been kind of crazy. We've done 32 events this year I've done already. We're getting ready to do your guys' event this Saturday. I'm
Yes.
excited about.
Yes.
But yeah, it's just I'm just loving it. It's just great. I just love it.
Good. Well, if anyone's interested in getting more information about Project Access, obviously visit your local community health center, ask about the information, but make sure to follow your social media page, like your Facebook,
Yes.
Project Access Wichita, correct?
Yep.
Okay.
Yep.
And thank you so much, Jennifer, for being with us. Truly appreciate all the work that you're doing and
Thank
all the
you.
information you provided for us.
Thank you so much.
Thank you.
Thank you.
Well, thank you guys for watching and listening to another episode of MedTalks. We will see you next time.